Good day everyone, I am Nathaniel Pilapil. So today, I am going to discuss the hematologic disorder in pregnancy. So, introduction. Hematologic disorders during pregnancy involve either blood formation or coagulation disorders. And hematologic disorders in pregnancy pose a significant challenge to both maternal and fetal health. This condition encompasses a wide range of abnormalities affecting blood components including red blood cells, white blood cells, platelets, and clotting factor. Managing these disorders during pregnancy requires a careful monitoring, risk assessment, and timely intervention to ensure optimal outcomes for both the mother and the baby. So these are the common types of hematologic disorders in pregnancy. These are anemia, thrombocytopenia, thrombophilias, hemoglobinopathies, and last is a woman with malaria. So first is the anemia. Because the blood volume expands during pregnancy slightly ahead of the red cells count, most women have a pseudoanemia in early pregnancy. This condition is normal and should not be confused with the true types of anemia that occur as complication of pregnancy. So these are the types of anemia that occur as complication during pregnancy. First is a woman with iron deficiency anemia. Second is a woman with folic acid anemia. And third is vitamin B12 deficiency anemia. So first is the iron deficiency anemia. It is the most common anemia of pregnancy, complicating as many as 15 to 25% of all pregnancies. Many women enter pregnancy with deficiency of iron stores resulting from a combination of diet low in iron, heavy menstrual periods, or unwise weight reducing programs. So by the third trimester, you need twice as much iron as before you became pregnant. Symptoms of iron deficiency: first is tiredness and fatigue, shortness of breath, pale skin, and heart palpitations. So this is how you can help to prevent iron deficiency. Eat a variety of iron-rich foods like legumes, eggs, meat, dark leafy greens, nuts, and seeds. And to help you absorb iron from your food, eat citrus fruits and avoid coffee and tea during your meals. So the next type is a woman with folic acid deficiency anemia. Folic acid or folacin, one of the B vitamins, is necessary for the normal formation of red blood cells in the woman as well as being associated with preventing neural tube and abdominal wall defects in the fetus. So these are the symptoms of folic acid deficiency. First is tiredness and weakness. Second is reduced sense of taste or smell, numbness or tingling in hands and feet, pale skin, swollen tongue, confusion or forgetfulness, mouth sores, diarrhea, and depression. So these are the some foods that can help you to prevent folic acid anemia. So first is cauliflower, asparagus, broccoli, leafy green, okra, mushroom, avocado, beetroot, papaya, oranges, seeds, nuts, beans, pearl, lentils, and etc. So the next type is a woman with vitamin B12 anemia. Vitamin B12 deficiency. A vitamin B12 deficiency is in pregnancy can also lead to anemia. Vitamin B12 helps to make red blood cells and protein. Eating milk, eggs, meats, and poultry can prevent vitamin B12 deficiency. Women most at risk for vitamin B12 deficiency are those who do not consume milk, eggs, meat, or poultry. So this is the vitamin B12 deficiency problems. First is anemia, hair loss, nervous system disorders, baby problems, and poor circulation. So how is vitamin B12 deficiency treated? So we should eat 45 cereals, milk, meat, shellfish, supplements, and eggs. So the next type of hematologic disorders in pregnancy is the thrombocytopenia. Thrombocytopenia is a condition in which you have low blood platelet count. Platelets are colorless blood cells that help blood clot. Platelets are stop bleeding by clumping and forming plugs in blood vessels injuries. Thrombocytopenia, defined as blood platelet count below 150,000 platelet per microliter, is the second leading cause of blood disorders in pregnancy after anemia. Gestational thrombocytopenia explain 70 to 80% of all cases of thrombocytopenia in pregnancy. So, how does thrombocytopenia affect pregnancy? So, there are two types. First is the gestational thrombocytopenia. It is not associated with maternal or fetal risk and does not require further investigation except for a periodical monitoring of the blood count. In these cases, a platelet count should not be obtained before epidural anesthesia. So the second type is the immune thrombocytopenia. This is an autoimmune problem where your body makes antibodies that destroy your platelets. It can happen at any time, but it can get worse during pregnancy. It can cause very low platelets, which may put you and your baby at risk of bleeding. So the next type of hematologic disorders in pregnancy is the thrombophilias. So thrombophilia is a group of genetical disorders that cause blood to clot abnormally. Thrombophilia is linked to current pregnancy loss, fetal growth restriction, late miscarriage, stillbirth, and preeclampsia. Clinicians usually apply the term thrombophilia only to patients with a typical thrombosis. So as we can see in the picture, in normal we can see a normal sized blood clot. And the time passed by, clot breaks down. While in the thrombophilia, we can see an excessive blood clot. And the time passed by, clot does not properly break down. So there are two types, the inherited thrombophilias and the acquired thrombophilias. Inherited thrombophilias genetic predisposition to thrombosis, such as factor B Leiden mutation and prothrombin gene mutation. While in acquired thrombophilias condition like antiphospholipid syndrome associated with recurrent miscarriage and thrombotic events. So the difference between the inherited thrombophilias and acquired thrombophilias. Inherited thrombophilias are abnormalities of the genes that are responsible for making the coagulation proteins known as the genetic mutation. Acquired thrombophilias are due to increased levels of certain clotting substances in the blood or special proteins called antibodies, which may also lead to clotting. So the next type of the hematologic disorders in pregnancy is the hemoglobinopathies. The hemoglobinopathies encompass a complex collection of red blood cells disorders that are responsible for considerable morbidity and mortality in women and their unborn children. Sickle cell disease and the thalassemias are the commonest hemoglobinopathies encountered in UK clinical practice. So the sickle cell disease or the sickle cell anemia is a recessively inherited hemolytic anemia caused by an abnormal amino acid in the beta chain of hemoglobin. If the normal amino acid replaces the amino acid alanine cycling hemoglobin results, it will substitute for the amino acid lysine non-cycling hemoglobin results. So next is the thalassemia. The thalassemias are the group of autosomal recessively inherited blood disorders that leads to poor hemoglobin formation and severe anemia. So the next type of the common hematologic disorders in pregnancy is the woman with malaria. Malaria is a protozoan infection that is transmitted to people by Anopheles mosquitoes. The infection causes red blood cells to stick to the surface of capillaries, causing obstruction of these blood vessels and resulting in end organ anoxia and blood not reaching organs effectively. So, how to prevent malaria during pregnancy? First is maintain a cold temperature inside the house and avoid hot places. Check if the place you are visiting is a malaria-prone zone and avoid if it's one. Wear light-colored and pollen clothes, especially while traveling. Try sleeping in an insecticide-treated bed nets that repel mosquitoes. Follow the complete anti-malaria medicine course of intermittent presumptive treatment under the doctor consultation rather. So these are the impact of hematologic disorders on pregnancy. So first is the maternal complication, increased risks of preeclampsia and eclampsia, higher incidence of preterm labor and delivery, exacerbation of underlying medical conditions such as hypertension and diabetes, complication during labor and delivery including postpartum hemorrhage. Second is in the fetal complication, intrauterine growth restriction due to inadequate oxygenation, premature birth and associated with neonatal complication, high risk of stillbirth in severe cases of hematologic disorders, developmental abnormalities in the fetus due to nutritional deficiencies and hypoxia. So next is the management of hematologic disorder in pregnancy. First is the preconception counseling, assessment of maternal health and optimization of nutritional status, identification of underlying hematologic disorders and risk factors, genetic counseling for inherited hematologic conditions. Second is the prenatal monitoring, regular blood tests to monitor hemoglobin levels, platelet counts, and clotting parameters. Fetal surveillance through ultrasounds and Doppler studies to assess growth and well-being. Third is the medical intervention, iron supplementation for iron deficiency anemia, administration of folate and vitamin B12 supplements, platelet transfusion for severe thrombocytopenia, anticoagulant therapy for thrombotic disorders under close monitoring. And last, number 4 is the collaborative care, multidisciplinary approach involving obstetricians, hematologists, and neonatologists. Timely intervention in case of obstetric emergencies such as hemorrhage or thrombosis. Counseling and support for pregnant women and their families regarding to the management of hematologic disorders during pregnancy. So in conclusion, hematologic disorders in pregnancy require comprehensive management strategies to mitigate risk to maternal and fetal health. Through early identification, regular monitoring, and timely intervention, healthcare providers can optimize outcomes and ensure the well-being of both the mother and the baby. Close collaboration among healthcare professionals and active involvement of the pregnant woman are essential in navigating the complexities of hematologic disorders during pregnancy. And that would be all for my report. Thank you and have a good day.